Hi guys, welcome to Fighting Multiple Sclerosis. Today I want to discuss a very important topic, vitamin D and multiple sclerosis. So what I would like to discuss today is why vitamin D is important for MS, when should you start taking it, how much should you take it, how do you monitor, what type of vitamin D should you take, and when to take it. And I guess a lot of questions surrounding vitamin D which I would like to address over here. So firstly, the most important thing, why vitamin D is important for multiple sclerosis. So now it has been proven beyond reasonable doubt that the incidence of multiple sclerosis is very less in patients who have adequate vitamin D levels. So vitamin D helps in neuroregulation, it helps in sort of immune modulation, and it also helps in controlling osteoporosis. Now, as we all know, when we have infections, when we have viral infections or bacterial infections, we have got an increased tendency for relapse, and also there is increased amount of fatigue. The circumstances you all know when we have fever or any sort of infection. Now, vitamin D is also known to fight infections, bacterial as well as viral infections. So all these reasons combined together makes vitamin D very important for us to keep appropriate and optimal levels of vitamin D. So that is why vitamin D is very important for multiple sclerosis. So when should you start taking vitamin D? Actually, if you see it, it is -9 months. So if you or your spouse is having multiple sclerosis, it is likely that your kids are at a slightly higher rate of having higher risk of having multiple sclerosis. So you should start taking vitamin D. The mother should start taking vitamin D during pregnancy itself, that is -9 months, so that the baby is born with optimal levels of vitamin D. So that is primary prevention of multiple sclerosis by use of vitamin D. By primary prevention, it means if you are at a higher risk of contracting multiple sclerosis, if you are at higher risk of having multiple sclerosis, if you start vitamin D, the risk goes down. Then vitamin D is used for secondary prevention of multiple sclerosis. By secondary prevention, what I mean is, if you are already a diagnosed case of multiple sclerosis, if you take vitamin D, the chances of the progression of the disease, the chances of you developing some disabilities due to multiple sclerosis goes down significantly if you have optimal levels of vitamin D. So that is primary prevention of multiple sclerosis and secondary prevention of multiple sclerosis by use of vitamin D. So how do you take vitamin D? Now there are two options, one is sunlight and one is supplements. Now sunlight is a very good natural source of vitamin D, but again there are a lot of variables involved. There are ultraviolet rays, especially in the Western world, the skin types are highly susceptible for malignancies, squamous cell carcinomas and basal cell carcinomas. In India, our skin types are relatively resistant, so we can afford to have a lot of, and we actually tend to do have a lot of exposure to sunlight. So that is one way of doing it. Sunlight in addition has also got other benefits apart from providing vitamin D. So obviously sun exposure should be done, but in addition to that, we should also have vitamin D supplementation. So how much vitamin D should we consume? So there are a lot of guidelines involving the supplementation of vitamin D, but I generally tend to take 10,000 international units per day or around 60,000 international units per week. So that is the general guideline which is recommended for patients with multiple sclerosis. Again, I highly recommend to consult your doctor before starting vitamin D. You might want to have your baseline levels checked. Then again, there is this risk which is I think more of a theoretical risk about vitamin D toxicity. So for that, obviously you need to monitor your vitamin D levels. The units of the vitamin D levels vary from country to country, but on an average, as patients with multiple sclerosis, we should try and maintain our vitamin D levels somewhere between around 150 to 250 nanomoles per liter. So that is the unit which is used commonly. It might vary in different countries. So we can regularly test our vitamin D blood levels at periodic intervals to see that we are not going in the toxic dose. Now, one more precaution that we need to take if we are taking high doses of vitamin D is we need to restrict our calcium, because somehow the vitamin D and calcium metabolisms are interlinked, and there is a chance of hypercalcemia, your calcium levels increasing if you are having or consuming more amount of vitamin D. So it is important that you also keep on monitoring your calcium levels. So that was about how much vitamin D should you take. Then coming to when should you take vitamin D, 10,000 international units you can take daily, or 60k you can take once a week. Regarding timing of consumption of vitamin D is a fat soluble vitamin, so the absorption is more when you take vitamin D along with fat. So it is better to have vitamin D along with your meals. Then there is another school of thought which says that vitamin D also improves the levels of melatonin in your body. So it is better that if you take it at night, it might help you in a sound sleep, which also again is a problem for many of us. So vitamin D should be taken at night with meals. That is the rough recommendation which I would like to give over here. But apart from that, if you are having problems, if you are more comfortable taking it, take it at any point of the day, but please do take it. Please keep your vitamin D levels at an optimal level. In which type of vitamin D should you take? Vitamin D3 or cholecalciferol is the general recommended modality. There are variety of types of D3 available. There are capsules, there are granules, and there are injections. So whatever modality is comfortable for you, it is totally our choice. The important thing is that we should just consume and optimize our vitamin D levels. So I think I have covered almost all the things about vitamin D which I had to make a point about. There is another thing which is called, which I would like to make a point over here, is regarding the Coimbra protocol. If you have not heard about the Coimbra protocol, if you have not yet read about it, I would request you to Google it. I'll just give you a few brief pointers over here regarding what Coimbra protocol is. So Dr. Coimbra is a Brazilian neurologist and who has worked extensively on the role of high dose vitamin D for multiple sclerosis and other autoimmune conditions. So he tends to give or recommend extremely high doses of vitamin D, even to the tune of 60,000 international units per day, or probably even more than that, obviously with regular monitoring of vitamin D levels and your calcium levels and parathormone levels. I personally have tried the Coimbra protocol for almost a year and a half to 2 years. I didn't perceive any benefits because of or rather with the extremely high dose vitamin D, but neither did I have any toxicity or any problems because of that. But yes, I think this is one thing which patients with multiple sclerosis would like to know more about, would like to explore it. There are a lot of testimonials available, there are Facebook pages, and even some amount of literature, scientific literature is available regarding high dose of vitamin D for multiple sclerosis. So I think that is all for now. I would just like to conclude again by stressing that vitamin D is important. Do supplement yourself with vitamin D and keep your vitamin D levels optimal, probably at the higher end of normal. So that's all for now. Stay tuned, guys. Cheers.